Hello. So I was tasked with looking at a very large question. Actually, it was not just one question, it was multiple questions. It was a question of suicide and harms toward others and the relationship with firearm access. But not just for everybody, but specifically for those who were at high risk for harming themselves or others. So this is a very, very specific sort of criteria that, of course, is complicated. So, as we all know, there is obviously very strong evidence that access to firearms is associated with completed suicide, and a history of psychiatric illness is also associated with suicide. And there is moderate evidence that access to firearms is associated with homicide victimization. And the empirical evidence, as Dr. Swanson knows very well, suggests actually that mental illness is actually not a primary influencing factor in violence. In fact, only about 4% of all violent acts in the US are committed by someone with a diagnosed mental illness, independent of, say, lack of diagnosing and so on. This is a very, very small percentage of the entire number of violent acts committed. And this number actually is very similar across countries. And actually, very recent research found that convicted murderers with severe mental illness are less likely to have committed that crime with a firearm than convicted murderers with a mental illness. Sorry. So that's interesting in and of itself. And I'm actually very happy that we have a panelist here talking about restraining orders today, because you can't really talk about harms outcomes, especially when it comes to firearms, without talking about interpersonal violence. And about half of all women murdered in this country are murdered by an intimate partner or a former intimate partner. And prior research has actually shown that females actually have a higher probability of being a homicide victim than males when you're comparing the firearms access. And access to firearms and prior arrests for domestic violence have actually been also previously associated with domestic violence or terrorism. So my task is big. My task is really to try to understand the nature or the body of the literature, to understand the impact of firearm access among individuals who are at highest risk. And we have two groups of people here, essentially. I have studies that have looked at the individuals who have firearm access among mentally ill patients or mentally ill participants on risk of suicide. And I also looked at studies that estimated the impact of firearms access among those with a criminal past on risk of homicide and or violence. So I'm the methods and stats editor for the Cochrane Collaboration HIV/AIDS group at UCSF. So I am doing a lot of meta-analyses for a lot of infectious disease and clinical questions all the time. And I've decided to apply those same skills to this particular question. So as a result, I have access to some of the best, I would say, search coordinators, if you would call them, that we know of. And I had a search coordinator. I gave him some terms, and I said, I need to find papers that have looked at firearms access and mental illness or prior arrest history and so on. And unfortunately, that's very broad. So I ended up with about 13,000 studies. We'll talk about that in a second. So anyway, nevertheless, there were PubMed and Scopus, which now includes Embase, and Web of Science was all used. I didn't have any limitations, meaning I didn't really restrict it by date or language or anything like that. I just looked at everything. And study designs included pre or post intervention evaluations or observational studies. And I included both population and individual level data. Again, two populations I was looking at, specifically those who exhibited suicidal behavior, which is a very broad term. This was a predefined term for me, and I will go into that in a second. And individuals with known risk factors for harming others. So the working definition for the suicidal behavior was previous suicidal attempts, aggressive or impulsive tendencies, depression, mental illness history, or drug or alcohol dependencies. And harming others included prior arrest for violence, previous convictions of violent crimes, and actually I included as well restraining orders, history of restraining order. So Specifically, the individual level studies that I looked at, individual level study is essentially for the non-data, this is kind of a dry topic, I'm sorry. For the non-data driven people, an individual level data basically is just a study that has actually assessed an individual's risk, actually looked at individuals' risk, actually interviewed in some way, like your typical clinical study. Population level data is looking at the rates, much like what Dr. Webster was presenting earlier, looking at rates over time in a given geographic area or what have you. So the individual level studies needed to assess firearms for all the participants, and the population level data needed to assess before and after some sort of policy initiative limiting ready access for individuals displaying suicidal behavior or harm to others. As an epidemiologist, I'm always concerned about the risk of bias, so there's this sort of standardized scale called the Newcastle Auto Scale. It's used quite a bit in Cochrane world. Anyway, so I use this to assess the risk of bias, all the included studies, all the included individual level studies, based on a number of criteria rated on high, medium, or low level of risk of bias. And then I meta-analyzed if I could. And by meta-analyzing, you're just basically synthesizing all the data and to get a summary estimate. And I pooled the data and got confidence intervals, and I used both random and fixed models. Depending on the heterogeneity, was determined by some statistic called the I-squared test statistic. And also the population level data, I just summarized with a narrative review. And there's so much data here that it's not really fair. I'm just going to be very front and honest right now. In 25 minutes, it's not honest or fair. It's not being fair to the data. There's a lot of work that's done in all this, and I'm going to very quickly go over a lot of it. So I apologize in advance if you're an author of one of these studies and you're upset that I spent 5 seconds. Okay, so this was just a study selection. I had about 13,000 titles and abstracts I reviewed. After I removed duplicates, and those were clearly irrelevant based on title, I ended up looking at about 165 full-text studies. Of those, 22 were included. 15 for the meta-analysis or individual level data, and 8 that were population level. Of the studies that were individual level, 11 studies actually estimated the odds of suicide comparing firearm access after adjusting for suicidal behavior. Okay, so this isn't exactly the question I was asked, which was among those who have suicidal behavior, what is their risk, if you will, for suicide when comparing firearm access? But this is still getting the risk independent of suicidal behavior, which is, I still felt like there's data out there that we should probably promote it. With that said, there were also 4 studies that either provided adequate data within the manuscript or I was able to actually get from the authors that estimated the odds of suicide comparing firearm access specifically among those with mental illness. So that is exactly the question that was asked. And then 5 studies estimated the odds of homicide adjusting for violent behavior history. And again, that's not exactly the question I was asked, but there were 3 studies that estimated the odds of homicide comparing firearm access specifically among those with violent or arrest history. All studies of suicide interviewed proxies to ascertain firearm availability. So when we talked about the risk of bias assessment, this was definitely one of the risks of bias, interviewing proxies. So we can consider all the different sort of recall biases or misclassification error you can have with those. Also, 2 of the 5 homicide studies also interviewed proxies to ascertain firearm availability. About a third of all the studies, the individual level studies, that adjusted for mental illness history were among adolescents only. But of the 4 studies that looked at only those with mental illness, 3 out of those 4 were among adolescents only. So you can already see my data are already sort of skewed toward the adolescents, and actually suicide cases were much more likely male than female. So again, I'm actually skewing toward not only adolescents, but adolescent males. So among the violence outcomes, all the studies were among adults, all of them. Homicide and violence cases were mostly males. In the non-IPV is intimate partner violence. Among the non-intimate partner violence studies, they were mostly males, and the outcomes were disparate, if you will, which you can imagine also makes it very hard to synthesize the data across all these different studies. Homicide victimization accounted for about 2/3. New firearm or violent offense was 20%, and then intimate partner violence threats was another 20% of the outcomes. So the meta-analysis, I across all 11 studies that looked at risk of homicide, comparing firearm access after adjusting for mental illness, I found a threefold increase in odds of homicide. So you were 3 times more likely to commit suicide if you had a firearm independent of your mental illness. And incidentally, out of these 11 studies, 10 of them found their individual point estimates were all significant except for one, which was the only non-US based study. Then I concentrated solely on the 4 studies that were specifically among those with a mental illness. And I found nearly a threefold higher odds of suicide. So this is among those with a mental illness, what are your odds of committing suicide if you have access to a firearm? And incidentally, of these 4, 2 had significant point estimates, whereas the 2 others were not significantly in and of themselves. So I also wanted to delve into the data a little more and find out, well, what about types of firearms or storage practices? So I did a subgroup analysis, and 3 studies actually provided adequate data for that. So again, this is among those with a mental illness history. And access to long guns or loaded firearms were actually not significantly related to suicide. However, access to handguns was actually very strongly linked with completed suicide among those with mental illness history. And I also performed a secondary analysis because for me, it's not just enough of, okay, among those with mental illness, what is their risk for suicide? But I think it's also interesting to look at it in the context of what about those without a mental illness history? I mean, what, relative to others without a mental illness history, what is your risk of committing suicide if you have firearm access? And then, you know, again, I'm limited by the data I have, but nevertheless, I had 2 studies that provided adequate data, and their pooled estimate for that was a little more than 4, so meaning they were 4 times more likely to commit suicide if they had firearms access among those without mental illness history. And the comparison of that pooled estimate with the among those with a mental illness history, there was no significant difference. Meaning, from what I can see from the data, not any difference between mental illness and non-mental illness populations in terms of their risk for suicide. Now shifting gears a bit, now I'm looking at the violence and harms outcomes. The pooled effect across the 3 studies that provided that data, adjusting for harmful behavior, suggested a 2-fold increase in the odds of homicide victimization. This is specifically homicide victimization. Again, as I said earlier, the outcomes were extraordinarily disparate, so that was the limitations of my meta-analysis there for harms outcomes. Now I have a number of sort of unique, solitary studies. So one study found no significantly increased odds of homicide victimization among individuals with households where at least one person had a history of arrest. Risk of violent offending among those who committed a prior violent crime was significantly higher among those who purchased assault-type handguns versus other types of firearms. Not exactly the question I was asked, but nevertheless, I still think it adds to the narrative. And finally, another study found a significantly higher likelihood of threatening a partner among those with recent firearm ownership compared with those without recent ownership. I also wanted to look at secondary analysis where I compared those with and without prior arrest history, and unfortunately only one study provided that data, and this link was not established. It was not significantly different, but it's, again, one study that provided that data. So that's the sort of summary of all the individual level data. Now shifting over to the population level data, I found 8 studies, 6 were primary analyses, 2 were reviews. Those 2 reviews are quite extensive. I'm not going to pull their individual studies that they included in their reviews, so I'm just going to sort of summarize what I was able to find. They had sort of 2 questions. I was looking at 2 different things, background checks and sort of restriction of firearm access as a result of background checks, maybe depending on mental illness or criminal past and so on. I also looked at waiting periods. I summarized all population level data in 2 tables. Okay, so essentially, I found that for suicide or self-harm outcomes, if you're looking at firearms restrictions or background checks specifically for suicide, when you look at the body of the literature considering population level data, essentially there is some evidence that there is a reduction in suicide, particularly among males. When you look at the waiting period, again, there's mixture of results. So, an arrow going left or right here really just means there's conflicting evidence, okay? So in the waiting period, there was conflicting evidence, but there is some evidence to suggest that there is a reduction in specifically firearm-specific suicides. And then we look at the violence outcomes across all the body of literature. The thing that struck me the most was that for the background checks, specifically for restraining orders, there's pretty striking evidence across all studies that have actually looked at it in terms of interpersonal homicide. So restraining orders in terms of background checks or firearm restriction do in fact have a big impact on firearm related interpersonal homicide. In terms of background waiting periods, there was conflicting evidence for waiting periods for either assaults or homicides or other types of violence as well. So, quick discussion about self-harm. What I found here is that from the available data, we know that firearm access increases your probability of suicide by nearly threefold. And there's really no evidence, at least from what I can tell, that there's a difference in this probability of suicide between those with and without mental illness. It's from what I can tell. And mental illness actually may not be an influencing factor beyond the baseline risks due to firearm access. Population level data found mostly inconsistent, largely inconsistent, but there was probably a marginally effective at reducing suicide. And similar to individual level data, I found that the firearm-related suicides were primarily driven by ready access. Waiting periods may also have a weak impact on suicide as well. And individual level data evaluating suicide are mostly limited to male adolescents, as I said previously. But this population actually might be, perhaps I shouldn't say most at risk, but they are very high risk. So perhaps that's why they've been studied so much. And this actually was also supported by the population level data. In the violence outcomes, mixed results for individual level data, assessing the risk of homicide or other violent outcomes comparing firearm access. And studies were just way too heterogeneous to meta-analyze, meaning they were just so different in terms of their actual question or their populations and so on, that to synthesize them would be sort of nonsensical. It would be apples and oranges. And just briefly, one study found a significantly higher likelihood of threatening a partner comparing recent firearm ownership, adjusting for restraining order, or even previous arrest for IPV, for intimate partner violence. And laws targeting individuals with a restraining order from accessing firearms are generally effective at reducing interpersonal homicide. And implications for the future, there's lots of implications, right? We have I've got some suggestions for possible research directions, but I'll leave it up for discussion. So policy regarding firearm possession and acquisition and its impact on violence should probably not necessarily focus solely on mental illness, but actually rather a history of violence from my perspective. And more reliable data may actually yield more impact on reducing violence. And future studies focusing on mental illness should be powered to actually explicitly compare diagnosis subgroups. Because when I look at these data, all the different studies have extraordinarily different definitions of what's mental illness. Some used drug dependency, some actually just looked at a history of it, some just used inpatient status. It's extraordinarily difficult to look at all of them as the same population. And future research suggests, and this is one of my suggestions, perhaps we could, in terms of intimate partner violence, we could look at, just an idea, if anybody wants to have any, help me out on this, collaborate. We could actually do a cohort study where you have two populations of, two cohorts of couples, and they have similar firearm prevalence, but they're in just two different areas, meaning one's in a state where they actually have a very strict restraining order laws for removal or at least acquisition of firearms, and another one where it's more lax. And you could actually follow that cohort over time and actually adjust for individual factors such as drug abuse or prior convictions and so on. So it's just a suggestion. It's not really well researched, to be honest, at least in the individual level data. Also, I feel like future studies would actually greatly benefit from thoroughly collected data about the actual incident, meaning the firearm type, the time, location, whether the firearm was legally obtained, and the circumstances. Believe it or not, that's not always collected. And also, individuals with certain types of mental illness are actually more vulnerable to violence victimization. So I'm thinking of like schizophrenia here. So I think this is actually an important point here. I think it's going to be a point that's going to be brought up again, I think, if we go pursue this, is that it's important for us to consider that future research actually should probably consider the effects of firearm laws actually might have on their ability to legally defend themselves, because they are actually much more likely to be victims rather than the perpetrators. And finally, to combat misunderstandings of the data and perception regarding the risk to society mentally ill pose, those at high risk should start with individual counseling, and communities in general should be educated about mental illness. And with that, I will leave it to Dr. Hemingway to attack me. So, that's one of the reasons why I included population level data.